Thanks, Chris. And I apologize for being a little late this evening. CEO called and said that he had to meet, and I have to do my duty. So there we go. He's not really aware of my schedule. So anyways, Chris asked me to talk about epidemic, the injury epidemic causes and prevention. I know many of you have heard a lot about these topics, even over the last few days. My topic is has these disclosures, which are updated regularly at the American Academy of Orthopedic Surgery website. You know, we started getting involved, as you heard from Chris yesterday, and when the HITS database was really starting to pick up. It started in 2010, and by 2013, 2014, we started getting a lot of data. And we were recognizing that some of the players were getting injured, but at a pace that would seem quite remarkable. But in our own practice, we're noticing many of these young kids getting injured. And we started just to get a feel, even without the HITS database, and really Brandon Erickson deserves a lot of credit. He went through the public literature and created a database, a very, very thorough database of all the UCL reconstruction players in MLB from 74 to 2013. And you're able to get that data all online. We're also able to get pitching data and all sorts of things, really quite incredible. And we found out in this situation, 179 MLB pitchers underwent a UCL reconstruction, 83% return to sport, 92% return to sport in the minors or majors, no significant decline in performance upon return to sport. That was kind of the general numbers now almost 10 years ago. We know that it's actually hard for some players to get back to the same level, but that number of about 80 to 85% seems to be holding up pretty well. Maybe with the repairs that we're doing at an earlier time, those numbers will be better. At least the early results suggest that. But it sort of gave us a parameter. And we started thinking, okay, who's going to get these UCL tears? Why is it going to happen? And why is this frequently happening more now? What are the current trends in treating this? Can we predict when a player is actually going to have this problem? And wouldn't they actually, when we return them back to sport, when should we return back to sport? We should protect them or not protect them? And what are the limits that are there? And we tried to go through the literature. We got a lot of help from many of the people that are speakers tonight and the last 2 days, as well as the HITS database, to answer a number of these questions. One of the very first things that we also did, moving away from the HITS database, but just taking the general numbers. Here's what the numbers were in terms of ulnar collateral ligament reconstructions in Major League Baseball pitchers per year. And this is the MLB, not just the minor league, but you see that number really started to hop up this past decade. It's kind of leveled off. And so we don't have now 50, 60, 70, but again, a lot of things changed from just 15 years ago that made us very worried. So we wanted to know whether there was any difference in the general population. We used a big data program called Pearl Diver to look at this. And what we found in this very large series of patients is that you see about 4 per 100,000 in the overall population. It was predominantly male, as it has been in all the studies, and there was a steady growth in this. But the thing that was most remarkable is that the age group where this really had been taken off was the 15 to 19-year-olds. And so that's really what sort of, we saw it go up in the major league players and the professional players, and then kind of leveled off, but really a dramatic jump in our younger players. And that's kind of persisted at this number too. So it's been remarkable. Chris has done some work on this from the New York study group and others. And we know that these young kids are really having a problem with this. And most of us are treating, the vast majority of our athletes we treat for this problem happen to be these high school kids and early college kids for this problem. What were the risk factors that had been identified or suggested? There was a number of them. Which was the priority? Which ones could we modify? All really good questions to try to figure this out. Pitch counts, of course, have been a big target. Pitching in consecutive days, fatigue, velocity. And so we'll try to look at a few of these things. One of the early studies that was done years ago was just looking at the effect of pitch type, pitch count, and the mechanics. And this was 20 years ago. And basically what they showed is that these kids pitching between 9 and 14 years old, that about 50% were going to experience shoulder and elbow pain, and that curveball seemed to be associated with a higher risk of shoulder pain. Sliders were associated with a greater risk of elbow symptoms in this patient age group. So we knew that was a problem. And what was really remarkable was that there was a significant association between the rate of shoulder and elbow pain and the number of pitches thrown per game and the number of pitches thrown through the season. And that was important because this really started to set the stage for pitch counts and other things. It was there before, but now we're getting some more evidence. Up until just recently, there actually wasn't a study that said, okay, what if you really followed the pitch counts well? Does that reduce your incidence? Or we basically really don't have any control over this? And this was really a question that Michael Axe actually asked at one of the Andrews meetings when we were there. And so we went and looked it up. And we looked at 638 youth pitchers at the Little League World Series. 62 or 10% progress to professional play. So when that young pitcher comes in and the parents think they're going to be the next Clayton Kershaw or whoever, remember that only about 10% are even going to get to professional play, but even less will actually be pitchers. So 56% of 56 of them were minor leaguers, and only about half of them pitched. And of the 6 that actually made it all the way to Major League Baseball, only 3 pitched. 1% of the pitchers from Little League World Series were able to make it to the major leagues. That's a pretty small number. And then what we found was some really interesting things with regards to injuries. Those that followed the pitch counts had much lower incidence of injury. So if you went and looked at the ones that did the pitch counts made in professional baseball, they did not follow it, about 11%. Those that followed, about 10%, pretty much equal. However, those that required to have elbow surgery, 50% of those kids that went on to play in the professional ranks that did not follow pitch counts required UCL reconstruction, only 2% for those that follow it. This is clear evidence that pitch counts seem to have made a difference, or certainly maybe is not the only factor, but certainly is associated with a reduced incidence of injury. And the question is, how much of a difference does pitch counts really lead to? And so Peter Chalmers looked this up and tried to help us out with that. And it's really a scary number. It's only about 10 more pitches per game, or about 500 more pitches per year. And that increases the incidence significantly with regards to those who are going to go on and have an injury. So pitch counts make a difference. Here's another way to look at this, and it's really sort of the volume of pitching. This is one where we looked at just pitchers throwing in the warmer versus the colder areas. The assumption is they're going to throw a lot more. They're going to play year round. They're not going to give their elbow rest. And when we looked at this, it was very clear that the warm weather areas, particularly when you get further south, like the Dominican Republic, Florida, Georgia, southern part of California, Venezuela, very, very high numbers. Whereas those in the cold weather areas, it was much lower. And so this was, again, evidence to suggest that pitch counts, or the amount of pitching, or the load that you put on your shoulder and your elbow, will make a difference to that elbow over time. And again, this is just some graphs from that demonstration. So the question is, how many innings can we throw? Does the workload influence an injury in Major League Baseball? Workload has been a topic we talked about last night. How do we measure that? We asked Brandon to give us a little bit more information on that the first night. How do you measure workload? Are the teams doing that routinely? How do we make sure we're not just overwhelming these elbows? And when we looked at this, we looked at a variety of different things in terms of who was placed on the disabled list for any reason, evaluated starting pitchers with at least 5 starts. And what we found was really quite remarkable. And as you see here, live game pitches, 57%, bullpen pitches, this number. And this is remarkable to see that when you had more pitches, you had a higher risk of having injury. Can we identify these at-risk pitchers? So we know some pitch a lot and they don't have a problem. So is there something that we can just look right at the player and examine them and see what happens? Well, it's kind of difficult to do. There's been a number of studies. Kevin Wilk and the people in South Carolina and Tom Noonan and his team have all looked at these things, as well as others. And so you look at preseason range of motion, a greater side-to-side difference, of course, between the two sides, with more flexibility on the throwing arm. But the one area that seemed to really pop out in Kevin Wilk's very, very nice study was the fact that if you have a reduction in the global range of motion, or total range of motion, that seemed to be correlated with injury. And in their study, GERD was not correlated with injury. However, we still have to keep in mind, although it's a little bit of, this is Kevin's work here, again, and looking down the total rotation deficit, that was the one that was correlated most highly with injury. There is some other evidence out there that there may be other factors. And so we just have to keep that in mind. And so in this, the side-to-side differences in horizontal adduction, played a role in their study that they did. And this was from the group down in South Carolina when they did this work. And then internal rotation loss of greater than 13 degrees, 6 times more likely to be injured. So motion loss is definitely a key. Total loss seems to be more correlated with injury, but don't put away the GERD yet. There's still a role for that stiffness in the back of the shoulder being related to the injury and causing things. And so we really want to look at this and look at these preseason athletes and screen them and make sure that their shoulders are flexible and they go into the season in basically a very good state of health with regards to their shoulders and elbows to minimize that. And the conclusions from these range of motion studies, as you can see here, deficits of greater than 5 degrees in total rotation or flexion had a 2.6 to 2.8 times greater risk for injury, respectively. And you're more likely to be injured in side-to-side differences when you had horizontal adduction of greater than 15 degrees difference or internal rotation of greater than 13 degrees difference when you're really measuring the difference between the two sides. And so this is very important to keep in mind as one of the ways to look at our athletes to try to prevent that problem, because we really would like to prevent the injury. You're hearing about great ways to fix the injury once it's happened, but why don't we try to do a little bit more to prevent that? There was created with USA Baseball guidelines and Little League regulations, a number of ways to look at this. There is the Pitch Smart program that Major League Baseball put together with a number of the faculty that are on this program that helps give some very nice guidelines. And this is what I frequently use for my patients, for my athletes and their parents and the coaches as a place to go to get some very good information. Michael Axe also has a very nice a paper that he wrote in Sports Health that gives some great numbers on that. But this is a really good reference to use for your athletes. And again, just emphasize to them, there is evidence now that if they follow the pitch count regulations, it can reduce their incidence of requiring elbow surgery. There's an actual published paper on that, and that's important. We also know there's a number of other factors. More than anything else, you can almost correlate these injuries with the speed that they throw. So Peter again looked at this and did some nice statistical analysis of that and figured out that peak pitch velocity was significantly higher among the pre-UCL pitchers than the control pitchers. And so when you really look at this, the peak pitch velocity was the primary independent predictor of whether a pitcher underwent UCLR. And so that's probably why we see these young kids now, because you see all the people using their speed guns, as Chris refers to, they're trying to get their velo up. And the more they do that, the harder they do that, the more likely they are to injure their elbow. And we see the velocity correlated with age. It gets harder and harder. So when 15 to 19 years old, we start getting to 70, 80, 90 miles per hour, and these injuries occur more often. And if you look at the percentage of injury related to pitch velocity, again, it's a linear graph when you look at these things. And so we really have to keep that in mind. And when you start seeing these pitchers, as we heard the very first night, you see these guys coming in, these superstars are going to throw 95 to 100 miles per hour. It's just a matter of picking the date on the calendar over the next couple of years when they're going to need their elbow reconstruction. At least that's what it seems like. I know they're not all like that, but there's really a pretty high correlation with those that just throw in heat all the time. One of the things that we don't have much control over, which is an interesting study, just looking at analysis of non-game injuries of Major League players using the HITS database again. These are injuries that occurred at least one day out of play. There was over 51,000 total injuries that were assessed. To look at this, 40% of them were non-game related. So I'm not really sure how we can prevent those. We can try to work with our athletes in a variety of different ways. And unfortunately, our pitchers had more non-game related injuries than game related injuries, which is really scary. But you look at this from throwing in a game versus a non-game, and you see the incidence of injuries is much higher in a non-game setting. So we have to keep in mind not only what they're doing when they're under the spotlight, but also what they're doing in practice, their bullpens and everything else. And I think that's where we have to figure out a little bit better about workload and how that plays a role and how this all works. Can we predict when they're actually going to have an injury? Again, this is another one of the things we try to look at with our younger players first to see if we could figure this out. And we went through a simulated game, and what we found is that as we worked through the innings, we noticed that their upper extremity kinematics didn't really change all that much, But as they became more progressively fatigued, they started to change the way they move their hips with their shoulders. So the hip shoulder separation significantly increased, and we could see that on video analysis. And Peter Chalmers is doing a lot of nice work on this now to look at that. But you see that open up early, puts a lot more torque on that elbow. We all saw with Hiro Sugaya a couple of years ago, he showed that the Japanese pitchers that are throwing way more pitches than we do, and he talked about how they really arc their spine and then come directly over the top, and he thinks that may minimize the amount of torque. Interestingly, it seems like when they come over to the United States, they get the United States disease anyway, so hard to know. Are there limits we need to set once they return to sports? So if they have the surgery, there's been some very, very high profile pitchers who have been restricted on how many innings that they can pitch after they had UCL reconstruction. Common sense would say that's probably a good idea, but the way that was selected, the amount of innings that was selected, usually ended up making it difficult for them to pitch in the postseason. And that was really, really public and critical. So we wanted to find out if there was any evidence. And the answer is zero. There's no threshold. So when they come back, if they pitch 100 innings, 120, 150, 180, and you hear someone say, well, that's because if they pitch more than that, they're more likely to have an injury. There's zero evidence that that's true. What we do believe, however, is that if you're a pitcher that pitches about 140 innings in the season before you have your UCL reconstruction, you probably shouldn't go back to pitch 200 innings the season after. You have to work your way back up to the same level you were and then gradually over. And this is, again, somewhere we have to do a little bit better in understanding the workload and how that plays a deal on this. So again, here's another revision UCL that they pitched more than 180 innings. Again, there was no correlation. Pitch graded 150 innings, no correlation. So this is kind of probably created by other factors than evidence-based indications for this. So there's a lot of different things, and many of you on the call tonight will probably say, well, you forgot this and you did do this, and what about, Dr. Schickenand's papers here and Dr. Dugan's paper here? There's tons of information. Just keep in mind, throwing hard all the time is not a great idea. That's a very high correlation with injury. Our young athletes have to be taught to vary their pitch speeds. We've got to reduce that incidence of 15 to 19-year-olds. We've got to examine them preoperatively and during the season to make sure there's no loss of range of motion. We have to reevaluate our assessment of workload. We have to figure that out a little bit better, which may help us understand. It's interesting if you do a UCL reconstruction and then you have a control group, the same pitchers in terms of the size of the player, their arm and everything else, and you look at the expectancy to continue their career, they're almost the same. When they come back, it's about a little over 3.5 years, whether they had the UCL or not. And you just wonder if that elbow just has so many throws in it over the person's lifetime in many of our athletes. And maybe we should figure out how to reduce those throws in that high school and early part of their career and extend it out. Unfortunately, they're all on stage every single time to try to get to the next level, so it's hard to do. Enhanced recovery, what kind of some of the things we can do? There's a lot of new information and try to get these muscles to work better so they can protect the UCL, and I'm sure that's going to help us out. And then there's going to be some very sophisticated things using the Motus sleeve to see how the torque is occurring, whether there's actually serum markers of potential injury. These are all things on the future that we'll be looking at. I'm sure we'll have some machine-based learning and some artificial intelligence-based learning, watching a pitcher throw over and over, and it's going to pick up where there's a variation in that hip-shoulder separation or other core things will give us more information. So I hope that's helpful for you to think about the future of this problem and why we have somewhat of an epidemic, why there's some ways to try to prevent it, and where the future is going to go to try to see if we can get better at keeping our athletes on the field. Thank you very much.